Nice vesicular sounds bilaterally. Now can you say 99 each time I count, touch you?
99, 99, 99, 99, 99, 99.
I can hear sound, but I cannot
99.
distinguish what it is.
99.
Now can you say E?
E, 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 E.
Okay, can you whisper 1, 2, 3? 1, 2, 3. I can hear sound, but I cannot distinguish it, so that is a normal finding.
1, 2, 3. 1, 2, 3. 1, 2, 3.
Okay, thank you. That will conclude our first part of assessment, and we're gonna move on to the heart in the next one. Now I will continue with our assessment of the patient thorax and lungs and heart. For the respiratory part, we also want to make sure when we inspect the patient, make sure he has no nasal flaring or any intercostal muscle involved in the breathing, and he's breathing nice and smooth. Also, I'm going to check nail beds. They are pink. Capillary refill is less than 2 seconds, and we're going to check for clubbing, and which would be a sign of COPD or emphysema, and he does not have that. While patient is in a sitting position, we're going to look for the apical pulsation, and I don't see it. It's probably going to be hard to see it in a patient or client who has pretty developed muscles. Oh, very muscular. So I don't see on this one. As I said previously, the chest itself, the bone cage, the ribs are in a normal shape. I don't see any deformities. There was no tenderness on palpation. I don't see any scarring. So we will move on to palpation, and I'll see if I can palpate apical pulse. And I still have a hard time to do that. So another trick that we can do is ask patient to lay down on the left side, and it can help on the left side slightly. Well, more one back. It's not going to be the best assessment bed, but a little more to the side. No, not back to this. A little more to the side, to your side, to your left side. I'm sorry. It's not a very comfortable assessment place, but this is what we got. And I'm trying to find apical pulsation. And I have a hard time. I can feel it. Now I can feel it faintly. And it's about right in here, which would be, this is the second intercostal space, third, fourth, fifth or sixth intercostal space, a little left from left or lateral to mid-clavicular lane. Okay. So now I'm going to take my stethoscope and I'll auscultate breath sounds. And I start with the first place on the second intercostal space to the right from the sternum, which is just above aortic valve. And I hear a nice, strong, regular S1 and S2. I don't hear any click on split. Don't hear murmur. Same thing on the second intercostal space left to the sternum, which would be above pulmonary valve. Now, in each spot I hear S1 and S2. I didn't hear any split or clicks. I didn't hear S3 or S4 in any of the position where I auscultated. Didn't hear any more murmur. And the pulse was strong and rhythmic, which that's how it's supposed to be. And that would conclude the normal heart assessment for the person who doesn't have any issues, and if there would be any abnormalities, there would be other tests that need to be performed. Thank you.